Hello, viewers, and welcome to another edition of your program, Straight Talk. With me today, I have a very special guest. He's a father and also a medical professional. I'm talking about no other person but our father, Dr. Olubayo Akinosun. You are very much welcome, sir.
Thank you very much, my brother.
Welcome to Straight Talk.
I'm happy to be here too.
How is the family, sir? How are you doing?
We thank God. God is keeping us. He's preserving us.
God bless you, sir.
Thank you.
Are you ready for Straight Talk?
Yes, I am. I love straight talk all the time. I love it. I love straight talk.
Okay, sir. So I would like to ask, do medical doctors, do medical professionals also pray for miracles, for blessings from God?
Oh, yes, we do.
You mean you pray
Personally, I always pray
that God should bless you?
that God should bless me miraculously.
If I may ask, how do you pray that kind of prayer? Do you pray that people should keep falling sick so that you keep having patients to treat and you keep making money?
Thank you, my dear brother. I don't need to pray for people to be sick. Since sin entered into the world, sickness came in. Of the people that are sick, I ask God, direct my own to me. The ones that you are going to bless me with, the one you are going to heal,
Okay.
the one you are going to glorify your name through, direct them to me.
So you don't pray that people should fall sick?
I don't.
You don't pray that they should fall sick?
I
But
don't.
when they fall sick,
When they fall sick,
they can come to
oh
you.
yes,
Okay, sir.
yes,
I would like to ask,
yes.
is the medical profession still about saving life or now about the money?
Thank you very
Because-
much.
Because back then, when people fall sick and they are rushed to the hospital, especially emergency cases, you see doctors already attend to them, ensuring their lives are safe first before they talk about money. But nowadays, without money, doctors rarely attend to people, no matter how terrible the case. In fact, even if the person is dying, you see them say, if you don't drop anything, we won't touch this patient. Why is it like that?
It is a pity that the whole world is changing. When I was training, we used to have everything in the hospital. We will move around patients that are sick that need to be investigated, blood samples. I put my hand inside my pocket, bring out bottle, take blood, put it there, write their names, put it on the table, and the ward mate will come and take it to the laboratory. Today is no longer like that. And I'm talking of a federal teaching hospital. If you do not pay, bottles will not be issued for any laboratory investigation in the federal teaching hospital. Because things are very costly. It's a form of revolving loan now, a revolving loan scheme in which federal government puts small amount of money and we use it, we buy, we recollect money, we buy, we recollect new samples to use. Now, when you talk of a private hospital, the doctor there used his own in-pocket money to buy those things. They must take something. If federal teaching hospitals today are taking it for needle, for syringe, for cotton wool, for gloves, you see, they must also take so that they can sustain themselves. And that is why we still rush to do emergencies. If somebody is bleeding profusely, we will not mind. We will stop that bleeding. And then we will be telling them, we will do this, we will do this, we will do this. Please pay. And that's exactly what is done in the federal hospitals also.
But sir, they are using the university teaching hospital
As example.
as example in Ibadan.
Yes.
We've had series of complaints that when people come for emergency, there is a place they are kept. Some people will be there for hours. They won't be allowed to enter. Some even die at that process.
I will tell you why. In a hospital, every life is precious to us. We are limited in number of staff. It is the doctor that will attend to the patient. If the doctors are attending to many people, for example, in a multiple accident case, all the doctors are occupied. There are other accident victims that are waiting. Somebody is now coming from outside, considering it's so to be important. What about these ones that are important to us? And what we do is to send somebody to go and review such cases, even in their cars, so that we know if this one is of a priority more than the present one. And that is why the ones that are of less priority, in fact, some people walk in to an emergency unit and start complaining. We say emergency unit is not for people like you.
For you to walk in, your case is not an emergency.
It's not an emergency. Because the people are very busy. The people are very busy. That is the thing. So they discover that the doctors are sitting down and they don't want to walk. They are walking tirelessly. Many times, all the beds are filled. Where are we going to put them? We even see them on trolleys. We attend to them on trolleys. But when the trolleys are now filled up, what are we going to do? We will stop attending to the others.
But Saifa would ask,
yes,
with what you've just said,
yes,
and the rates at which we hear medical professionals jetting out of the country for greener pastures,
yes,
for better life,
yes,
what does the future hold for medical professionals in Nigeria and for people in general?
No, Nigerians are training to become medical professionals. The hospitals, the universities are producing people. So Nigeria does not have problem about production of medical people. What Nigerians have as a problem is retaining them. Many are gone. Some retired. Some died. They have not yet been replaced. Which means the lecturers are becoming fewer. If government does not do something to make sure that they retain the ones that are on ground, the younger ones will also look for another place to go. That is the trouble. It's not only the doctors that are jetting out. I can tell you, there was a year you are employed 130 nurses here at a time. Within 2 months, 100 left the hospital. The 130 that we employed that time is now saying we are employed only 30. And don't forget, apart from those people that left, others are retiring as age catches them. So as people are leaving, we are not following up with appropriate replacement. That is the problem we are having. So when we talk about the future, our leaders should think of doing what they normally go outside the country to receive. When they go outside the country, most of the doctors that see them are Nigerians. I was told of a hospital. They even sent the picture of all of them working in that hospital. From the most junior to the consultants in that particular unit, only Nigerians. Only Nigerians. How will we continue that type of a thing? That's our problem in Nigeria.
So I would like to ask.
Yes.
Many people would want to know,
yes,
how do medical professionals determine rates for their treatment for the patients? Because many people believe that doctors charge based on their mood. In fact, a friend once jokingly said, if you are going to see a doctor,
Yeah.
don't dress nice. Dress beggarly and be begging them so that they won't give you high bill.
That's in a private hospital. That's in a private hospital. Eh? I love that. Eh? You know, there's a market in Ibadan here, Oje Market,
Okay.
eh? Where things are really relatively cheap.
Okay.
But if you dress gorgeously, and I've had the same thing, that the rich people also, they change it to one of their own dresses.
Yeah.
Now, when we talk about charges in medicine,
Yeah.
it's relative. In the government hospitals, prices of individual things are already fixed
In government establishment.
in government establishment.